The Health for All partnerships came about right at the beginning of the pandemic. We thought, there's so much need here in Toronto. Certainly we can do something about that.
One of the most fundamental component of this model of care is the relationships that we have with our community partners. The clinic was built from the get-go with our community partners through their input, through their leadership, and certainly through their knowledge of the communities that they already serve.
We definitely see clients that come sometimes daily or weekly, and we support them, whether that's related to their mental health. The students are also engaging in health promotion activities.
We don't just look at physical aspects of clients. We really get to see what emotional needs do they need, what social supports do they need help with other realms, whether that be food or whether that be housing or mental health support.
I think the greatest successes are that many clients have been received into these spaces. They have received the type of care that they want because it was, based on a needs assessment. So what the clients wanted in a community care center like this. And also the other biggest success is the transformational experience of the students. So last year we had a lot of interviews with students who were able to do a placement here in their final practicum of the Bachelor of Science in Nursing program. And it's been very positive.
What I can share is that the HAP Clinic was the best part of the Bachelor of Nursing program for me. Because my final semester was my preceptorship. I invested the most amount of my energy in it. And I felt like I was equally rewarded in the fact that I was given the opportunity to do something I couldn't do anywhere else. It is a very unique program. I don't think you can find something like the HAP Clinic at any other school. We went into a community, we were welcomed in by a community, and we did as much as we could to empower our community members, advocate for them, and improve their lives. We really built relationships with our neighbors.
I think this placement is a very important aspect of my career development because nursing is not just about acute care, it's about the leadership, it's about communication, and a lot of those skills are things that I can't really do at a unit. And so here I'm given a lot of opportunity and a lot of autonomy.
I really believe that a model like this can really maximize that benefit of not just future student nurses to appreciate the kind of impact that they can provide, but certainly already through their programming, through their education, the skills they already have to already start making that impact.
What inspired me to go into nursing was working at the community in my home country. And it just felt full circle that what inspired me to go into nursing is an opportunity to give back to the community.
People still today think nursing happens at a bedside under a medical model with the doctor telling you what to do for that client. And this is the next step. This is what's going to save the healthcare system.
When I think about how much Humber has actually assisted our clientele in opening their eyes to what healthcare is, how you all have actually helped even our own workers who were in doubt of the medical system become more familiar with it, become more familiar with nursing, become more familiar with the actual Canadian medical system. They trusted more, their clients trusted more, and more people start to come in to actually explain what they need. But I'm seeing in the students and the preceptors, there's excitement, there's joy, there's happiness to actually help people out. They're just excited to be a part of it. And I love seeing that.